so now we're going to do cervical range of motion with the goniometer. First thing we're going to do is cervical flexion. So we're going to line up our axis with the external auditory meatus. Our stationary arm is going to be perpendicular to the ground, so straight up, and then our moving arm is going to be lined up with the base of the external nares of the nose. Okay, so we're going to line it up like this. Now, we're going to have Logan sit up straight, and if our patient can be compliant, that's great. If not, you may need a strap, or you may need someone else to help keep this part stabilized so he doesn't use his thoracolumbar region as well. All right, Logan, so I want you to bend forward with just your neck and go down to tuck your chin. All right, so we are at 45 degrees. You can come back up. So that would be 0 to 45 degrees, active range of motion, cervical flexion. Okay. So extension, we're lined up the same way, but this time let's do it passively. So we're going to be here. Now Logan, I want you to let me extend your head. Okay. There we go. So that is also 0 to 45 degrees, passive range of motion, cervical extension with a firm infill. Okay. Next we're going to do rotation. And to do rotation, we're going to have our axis right here at the center of the cranium area. We're going to have our stationary arm in an imaginary line between his two acromion processes, and we're going to line this up with the tip of his nose. Okay? So Logan, I want you just using your head to make this motion to turn this way for me as far as you can with your chin. Okay? Alright. So when I tell you, now I want you to rotate it. Okay? And we are at 60 degrees. 0 to 60 degrees active range of motion of right cervical rotation. Now back to neutral. Alright, so this time we're going to go this way with it. Alright, I'm going to do it passively. Okay, so Logan, let me do it as we go around here. Okay, all the way till we feel that. Okay, so 0 to 60 degrees, passive range of motion, left cervical rotation with a firm infill. Okay, the last one is actually going to be lateral flexion each way, and in order to do that, we're going to line up our axis with our C7. So remember, our C7 has that prominent spinous process on it. Okay, so we're going to come down and we're going to palpate till we find C7, very prominent here on Logan, and that's going to be our axis. Our stationary arm is going to go down our thoracic spinous processes, and our moving arm is going to be actually lined up with our occipital protuberance. Now Logan, sit up straight again for me. Keep your head neutral, and I want you to laterally flex this way. Okay. So I'm getting 45 degrees. So 0 to 45 degrees active range of motion of right cervical flexion, lateral flexion, back to neutral. All right, Logan, this time let me do it. And line back up again with C7 going down the thoracic processes and the occipital tuberance, and I'm going to flex him this way. 0 to 45 degrees passive range of motion of left cervical lateral flexion with a firm infield.